Welcome back. You're watching McLaren Port Huron's Today's Health Program, and in this segment we're going to be talking with Pat Keigher. Pat is the Regional Director for Cancer Services for McLaren Macomb, McLaren Oakland, and McLaren Port Huron. Pat, we're so happy to have you here today.
Thank you. It's a pleasure to be here.
How do you see, you have a big job, a lot of space you're covering, how do you see this addition benefiting the community?
I think this is a great opportunity for McLaren Port Huron to take its cancer services to the next level. Being affiliated with Karmanos Cancer Institute is a huge opportunity. The quality of care that will be able to be provided to the patients in this community will be among the nation's best.
We've had exceptional cancer services, and yet we understand that joining something like the Karmanos Cancer Institute offers many changes and benefits. What do you see some of those changes as being?
Well, I think with the Karmanos Cancer Institute, the services that will be brought to this community are the highest standard of care in delivering cancer treatment. Karmanos is a comprehensive cancer treatment center, which is a very unique designation by the National Cancer Institute. There's only 2 in the state of Michigan and about 41 across the country. So Karmanos Port Huron will be able to provide that same level and standard of care to the patients here, close to home in one convenient location.
So when Karmanos puts their name on it, in effect, the how you provide care is the same across all of these sites?
Absolutely. There's clinical integration process that every Karmanos Cancer Center has to go through. So the benefit doesn't come with the name Karmanos. The benefit comes from the level of quality in the integrated practices that are going to be incorporated to each Karmanos Cancer Center. So I think that's really the big benefit that it's going to bring the community.
Tell me a little bit about how the physicians and care providers work together to take all of the patient's information and go through it on a regular basis. Well,
Karmanos Cancer Institute provides a network of expertise of clinicians, whether it's oncologists, surgeons, specialists in providing cancer treatment. The quality of the staff, the competency of the staff is very high. The physician team is able to bring expertise to all of the community-based sites, such as Port Huron, Macomb, Oakland, from the main center down in Detroit. For example, through electronic tumor boards, typically a patient's case will be discussed locally amongst a radiologist, a pathologist, the surgeon, and all the variabilities of that patient's diagnosis are discussed at a team level. With the Karmanos affiliation, those patients will also have access to the specialist downtown, either through electronic tumor boards, where the physicians meet through a webinar, webcasting, or the patients can be referred downtown for that treatment. But the biggest benefit is that the consistency in the way the care is delivered at each location is consistent with the same equipment, the same best practices, to reach the highest quality of care.
The other thing I like that you've been talking about is you've been bringing the patient into every single conversation. How do you keep them involved? Because a cancer diagnosis is just overwhelming.
It is, and I think one of the key pieces of any cancer program, and is a part of all the Karmanos cancer locations, including Port Huron's, is the use of an oncology nurse navigator. Her role is integral in getting that patient from diagnosis to treatment and on to survivorship. The patients are diagnosed with breast cancer. Not only the patient, but the family is overwhelmed. They're frightened. They don't know what's around that next corner. Their life has just been turned over. And the navigator, who is typically a nurse, will just bring all those pieces together and be that guide, be that compass for the patient to get to survivorship, coordinating appointments, helping them understand the information, assessing them for psychosocial needs, nutritional needs, do they have financial concerns, and how to get them in connection with the resources that they're going to need. And many times, that's the role of the loved one or the spouse or the daughter, you know, of that patient. So she kind of works in combination with the entire family, kind of a team approach.
Do you have closing thoughts for our viewers?
I think this is a very exciting time for this community. The Cancer Center here is going to be absolutely beautiful. It's going to incorporate natural beauty, picturesque views of the Pine Grove Park to create the best healing environment for the patients. So I think there's a lot on the horizon. Being a part of McLaren Healthcare as well as Karmanos Cancer Institute is just going to be a huge benefit for this community.
Thank you so much.
Thank you.
And thank you for joining us today. It's been a very exciting program. And if you have questions about anything we talked about, if you want a copy of this program, please call us at Health Access. That's 1-800-228-1484. You know, you can always go to our website. There's just so much information there. And you can also watch any segment of this program over again. And that is mclaren.org/PHTH. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health.